COVID-19 levels in Massachusetts wastewater nearly quadrupled over 2 weeks in July, now standing at about twice the national average, according to the latest data from the Centers for Disease Control and Prevention, CDC. As of July 20, Massachusetts recorded 13.53 coronavirus RNA copies per milliliter of wastewater, compared to the national average of 6.14 copies per milliliter. This sharp increase, which saw levels rise from 3.64 copies per milliliter just 2 weeks prior, signals a significant uptick in viral presence in the community. Wastewater testing is a critical early warning system for public health officials, allowing them to detect the presence of the virus in communities where individuals might not yet show symptoms. This method of monitoring can provide a more comprehensive view of the virus's spread compared to testing individuals alone. The current rise in wastewater COVID-19 levels suggests a late summer wave, a pattern observed in previous years, though it is notably less severe than the typical winter spikes. In New Hampshire, a similar trend has been observed. The state's wastewater showed 14.49 coronavirus RNA copies per milliliter as of July 20, up from 4.93 copies per milliliter 2 weeks earlier. This sharp increase places both Massachusetts and New Hampshire among the 19 states classified by the CDC as having very high levels of the virus. This classification highlights the significant presence of the virus in these regions and underscores the importance of continued vigilance and public health measures. Despite the rise in viral levels, the number of severe cases and deaths remains relatively low, attributed to high vaccination rates and improved natural immunity within the population. The Massachusetts Department of Public Health noted that the current surge is lower than what is typically seen during the winter months. This indicates that while the virus is still present and spreading, the overall impact on public health is being mitigated by existing immunity and vaccination efforts. Other states with very high levels of the virus include California, Oregon, Washington, Florida, and several others across the country. States like Maine and Connecticut are experiencing high levels, while Vermont and Rhode Island have moderate levels. The widespread presence of the virus in wastewater highlights the ongoing need for public health surveillance and readiness to respond to potential outbreaks, even as the severity of individual cases remains lower than in the earlier stages of the pandemic.